Hello, everyone. I've been thinking a lot about heart disease lately and thought it might be interesting to do a piece on the heart. Pretty much every single day, I see patients with some form of heart disease, and that really shouldn't be all that surprising considering that heart disease is the leading cause of death in the United States, so it ends up being on my mind a lot. The numbers vary a bit year by year, but it works out to be about 1 in every 3 deaths that are caused by heart disease, with someone in the US dying from heart disease approximately every 34 seconds. And that's just looking at deaths alone, without even looking at the massive amount of disability, reduced quality of life, and costs associated with heart disease. Despite the fact that it's so common, I still feel like there is a lot of confusion about heart disease, so hopefully I can help provide a couple of useful insights on the matter as I go, and maybe even motivate a couple of people to try to take some steps to prevent or at least delay the development of heart disease in themselves. In terms of method, this piece was pretty challenging overall, and I wanted to try out a couple of experimental things as well, so let me know how you think it turns out in the end. Honestly, after my last piece on the uterus, I spent a couple of days feeling pretty down about it. Like, it just really didn't end up looking as good as I would have hoped. And even though I'm obviously only an amateur at best, I still sort of felt like it ended up looking a little extra amateurish, if that makes any sense. I eventually got over it and managed to give myself a little bit more grace, but I still think that in part my dissatisfaction may have been due to the fact that I based my drawing on diagrams rather than a real anatomical example, which I think does make a pretty big difference, as the style of art I've been working on inherently has something of a cartoonish look to it, due to only using thick black and white lines. And I think rooting the illustration to real examples of organs helps ground it a little more and adds a bit more realism to the final product as a result. So this time around, I made sure to base my initial sketch on only real cadaver specimens of the heart. But part of the challenge I found was that no single image really had the exact view I was imagining in my head. Obviously, inside the body, the heart is covered in all kinds of tissue, has many different connections, and it's surrounded by adjacent organs that block certain views of it. And I really couldn't find a perfect section that was giving me the view I wanted. So I ultimately had to do a fair amount of freehand work, doing my best to sketch out different parts of the heart based on several different dissections at the same time. My goal was to have a realistic anatomic view of the heart and the thorax, with only really the surrounding vasculature or blood vessels attached, which proved to be pretty challenging, but I think I ended up quite pleased with the result. I think this provides more of an interesting view to me because even when you see images of quote-unquote realistic hearts, they typically aren't portrayed with accurate connecting vessels, and rarely, if ever, are they actually shown in the correct orientation inside the body, as the heart is a 3D organ that isn't perfectly aligned with the horizontal axis of the body, and the apex, or the pointy bit at the end of the heart, is kind of tucked back at a diagonal angle instead of being in the same horizontal plane as the chest cavity. Including all the connecting vessels also complicated things further because it made it much harder to determine which vessels were connected once they were all sketched out, especially with the branches of the aortic arch and those of the superior or upper vena cava. So I had to be really intentional about the direction of the lines I drew to help distinguish those different parts of the heart, as well as to give them a sense of depth. And you'll note I made several changes before getting it right. This was also the first time I had done an organ without closed boundaries, as I thought it would be more visually interesting to continue the line pattern down from the connecting vessels into the background pattern, giving an appearance of continuity, like everything was still connected, instead of arbitrarily cutting off the vessels at some point with a clear delineation, which I feel like would have looked a bit more cheesy. For the background, I also decided to be a bit more intentional as well. Instead of just making arbitrary aesthetic curves, I ultimately changed my mind and chose to make spirals the predominant feature in the background. I wanted to try this as the effect of the optical illusion is most intense when moving perpendicular to a set of parallel lines. Meaning, if you were to move your eyes sideways across a series of lines running up and down. While there is a strategic dead space in some of the other pieces I made, where there are patches that don't really have the effect as strong next to other patches where it is stronger, I thought it would be interesting to do spirals this time in an attempt to maximize the effect, no matter which direction the viewer was moving in. It does draw the viewer's eye to the background a little bit more than I like due to the more prominent pattern this time, but I think the symmetry and spacing of the spirals still helps diffuse that effect a little, so hopefully it doesn't draw attention away from the heart too much. Honestly, the heart and cardiovascular system was probably one of the topics I struggled the most with during medical school. Maybe part of that was due to some natural difficulty I had with the pathophysiology, I don't know. But I think the bigger issue was that our son had been born during the block right before the cardiovascular system, and I really just wasn't getting enough sleep or the time I needed to learn everything completely. Having children is a complicated, rewarding challenge, and most of the time it's one that people don't really bother tackling during medical school, which is also a very difficult experience on its own. I did my best, like with every other class, and I even felt like I understood the material pretty well, so I wasn't really all that worried despite everything else right up until the point where I submitted my final and got my preliminary score back. And then I was. It was bad, like failing bad. I remember going to the test review afterwards and looking at my answers and wondering why on earth I had selected some of the choices I'd made. Like they just didn't make any sense to answer the questions. And it was only at that point that I realized just how sleep deprived I had been when I had taken that test. And that sucked because, well, there's not really a lot of time for catch up in medical school, and there really wasn't much I could do about it. It can be pretty difficult already to tell when you're chronically sleep deprived, and even if I had noticed, I doubt there would have been an acceptable excuse for the administration that would have allowed me to take the test again later. Ultimately, they did end up curving the test by a few points for the whole class, and I didn't have to make anything up to pass the course. But even afterwards, I found in my later clerkship courses, which are the courses that aren't organized by organ systems, but they're organized by specialties like surgery, psychiatry, etc. In those classes, I would still consistently score lower on cardiovascular system related topics. It wasn't until I finally started studying for Step 2, which is this huge exam that covers all the specialties, that I finally had some dedicated study time and actually got the chance to focus on the heart and really help make up for some of those deficiencies. And now that I'm an actual doctor, I treat heart disease all the time without any issues. I guess I included this story because I just wanted to add a little bit of my own perspective on hardship. I know that for most people, mostly failing a test in medical school and juggling a newborn may really be a tame example. But for me, it felt pretty overwhelming at the time. And I just want to say for those struggling with parenthood, or those struggling with their studies or their exams, or even those poor souls still in medical school, it's okay to make mistakes. And it's okay to struggle. It's okay to have weaknesses, even for a long time. Things may not always end up exactly like you dreamed they will, but if you just keep trying and you work towards your goals with consistency, they'll still get better. And maybe even one day you'll turn those weaknesses into strengths. But even if you don't, you'll still become a better person just for having tried. Even if you make no difference, you don't improve, and your circumstances don't change. If you keep doing your best, keep trying, and stay patient and consistent, you will change. To quote Brandon Sanderson, Doing hard things has intrinsic value, and they will make me a better person, even if I end up failing. As long as you keep trying, you'll become the type of person who can do hard things, even in the face of impossible odds. You'll become the type of person who can stay optimistic, even when things get tough. You'll become the type of person who can be patient in the face of adversity, the type of person who can diligently apply themselves, no matter the task. And you'll develop the ability to judge your own worth not by what you accomplish, or by what others think of you, but by how you feel about yourself. You may even discover that your true value derives not from what you do, or from what you accomplish in life, but from who you become instead. Journey before destination. Now, transitioning from one soapbox to another, let's talk a little bit more about the real medicine before the medicine. When it comes to heart health, diet and exercise are king. There are no deathbed substitutes for a lifetime of healthy eating and regular exercise. Unfortunately, that's so much easier said than done. And the truth of the matter is that in many ways, even though we're so quick to point the finger at individuals and blame them for their personal choices, we truly are shaped and influenced by the environment we live in. And for most of us in the US, our culture, our environment, and our policies are massively failing us. Yes, of course, everybody can make their own choices to live healthily, but it is far easier to make good choices when our environment also encourages it. Our culture around food, for example, is crazy. Restaurants and fast food places normalize overeating by giving insane portions and establishing that as a normal meal size. A full combo meal from your regular fast food place, for example, meaning a sugary drink, fries, and a burger, teaches you by its name alone that that is what a normal meal size should be, when in reality it's closer to double the appropriate portion. On a related note, if overeating in portion sizes is something that you personally struggle with, next time you eat out, something that you could try that could help with that would be considering cutting or splitting your food in half at the beginning of the meal and setting half of it aside in takeout containers before you even start. Or if you're eating with someone else, you can also try ordering one entree and just splitting it with them instead. At home, try actually measuring portions or serving sizes on the foods you make and dividing it appropriately. And that's another way that you can help teach yourself what a normal amount to eat should look like. Another huge issue we face is the quality and content of the food we eat. Again, somehow our culture has decided to teach us that every meal, by default, should have meat in it. Like, if you go out to eat and something doesn't have meat, it's vegetarian. This whole magical different category or classification of food for special people, instead of just, normal food. The next time you go out or shop for groceries, pay attention. And once you see it, I feel like it's pretty hard to miss. Everything has meat. And almost everything else that isn't is carbs. Fruit and unfried vegetables are used for garnish only. Like 2 measly pickle slices between the buns and fried chicken on your Chick-fil-A sandwich with a side of fries, and that's a meal? Oh yeah, sure, you got a deluxe sandwich. Add a single leaf of lettuce and a thin slice of tomato. Somewhere along the way, vegetables became optional instead of the main ingredient in our foods. Now they're seen as health food instead of just food. Now, I know I'm telling people to shower while I'm sitting here covered in mud on this one too, but at least I see the mud for what it is instead of calling it healthy and wallowing in the mire. For those of us who struggle with food content and quality, I think the simplest and one of the most effective pieces of advice I give patients is to start by simply adding in fruits and vegetables. Many people are out here struggling to get any at all, so even a little bit is a good start. But there's also the convenient fact that we only have finite stomach space, so any extra fruit or veggies you add will slowly start to displace some of the other less healthy food that we normally would be eating instead. Just make sure to eat the healthy stuff first. There is a lot more that could be said about diet, but the bar is already 6 feet under, so let's just work on getting it back to ground level and leave it there for now. When it comes to exercise, once again, our culture is doing us absolutely no favors. Our infrastructure is built around keeping us sitting. It forces us to use cars instead of walking to and from effective public transit systems. It keeps bikes out of the road with poor and unsafe design, and it encourages us to drive with unwalkable roads and poorly distributed commodities due to separated suburbs and commercial centers. For some reason, unbeknownst to me, people also tend to prefer big cities, often with bad and broken sidewalks, if and where they may actually exist, areas that are unsafe to walk around, few natural paths to enjoy, and overcrowding of the sparse areas set aside for public recreation, like parks or sports, which are usually not equitably distributed anyway. Again, when it comes to exercise, there's so much more detail I could go into, but honestly, so few people exercise consistently that I tend to stand by the general advice that the best exercise is the kind you'll actually do. So if that just means walking around the block a couple times, then great. Please keep up the good work. If it means marathons, then I don't get it, but good for you. If I had to set at least one qualifier, however, it would be this. If you really want to benefit yourself with exercise, then you need to raise your heart rate above baseline. So just keep doing whatever you love or whatever it is that's at least tolerable enough to get you up and get you out of bed. And next team, aim to go just a little bit harder, a little bit faster to make sure that you're raising your heart rate above baseline for an extended period of time and really seeing those healthy benefits to the heart. And again, even if our culture isn't helping, exercise is at least one of the few things that you really can still do for free. You don't need a gym membership, you don't need fancy clothes or equipment. Even if you're just doing a few push-ups and squats each morning in your underwear, that's still a good enough place to start, and you'll still see benefit. While diet and exercise are the first things I recommend to improve heart health, sometimes medications are necessary too. Often this means medications to help with cholesterol, usually something that ends in statin. While a statin may be advisable to help lower cholesterol in individuals who've struggled with diet and exercise, that isn't always the case. Sometimes people just have a genetic predisposition for high cholesterol, even if they're doing everything else right. And that's okay. Nobody should be feeling bad about themselves for needing a statin one way or another. Statins aren't a judgment of worth or value, they're just a medication. So, how do doctors typically know when to start a patient on a statin? Well, most often, a primary care physician is going to be using something called the ASCVD, or Atherosclerotic Cardiovascular Disease Risk Calculator. This is a risk calculator that was made using huge amounts of population-level data to determine what factors increase the risk of somebody having a serious cardiovascular event, meaning a heart attack or stroke, within the next 10 years of their life. If we reference the U.S. Preventive Services Task Force recommendations, it's recommended to start a statin if the 10-year risk of a serious event is 10% or greater, and to selectively start a statin if a patient's risk is 7.5 to 10%. While the specific recommendations will vary somewhat depending on what organization you reference, suffice it to say that while there is a certain level of risk where improving diet and exercise alone is likely enough, if a physician is recommending you start a statin, then it's likely a good idea in addition to making some lifestyle changes. Now, I'm no stranger to patient stories about seeing a doctor who doesn't even talk to them about diet or exercise and just tells them to take a pill instead. And unfortunately, there really is some truth to that. I know that I definitely could have done better myself on more than one occasion. Unfortunately, the brutal reality of medicine is such that more often than not, we don't have the time to get into the nitty-gritty of detailed, specific lifestyle counseling. In my own experience, when I've got 20 minutes to see a patient, verify they're taking all their medications at the correct dosages, review their interval history and notes from outside specialists, investigate whatever 2 or 3 new concerns they usually bring up, run through all their screening recommendations and say, for example, teach them about why it's important to get a colonoscopy, to get their pap smear, get their lung cancer screening, and a mammogram. and then also tell them why they should be getting their pneumonia vaccine. Then refill any meds they need and maybe prescribe something new, place a couple of lab orders, examine them, and write an after-visit summary for them. It can be pretty difficult to fit in specific, personalized advice about how to improve their diet and exercise, let alone explain the nuances of the fact that even if they did improve their diet and exercise, they really should still start a statin anyway due to their overall risk score, especially when they show up 10 minutes late. Unfortunately, I just don't have a great solution for that problem, but I wish it was different. On a related note, I know that there has been a lot of rhetoric recently about how doctors don't get a lot of specific training on nutrition in medical school. And in an ideal world, would, the entire US healthcare system focus way more on prevention and living a healthy lifestyle? Absolutely. But when it really comes down to it, I don't think that doctors not knowing enough about nutrition is anywhere close to the real issue here. It's not like spending an extra week on nutrition in medical school is going to somehow magically fix our entire corrupt insurance, pharmaceutical, political, sick care machine and make everyone healthy again. It's more of a red herring. It's just another convenient distractor for those who profit off of abuses of the system. And the honest truth is that everyone pretty much knows what they should be doing already anyways. Eating more fruits and vegetables, eating fewer sweets, and eating less overall. We're just not very good at doing it. Our culture subverts healthy dietary choices because hyper-palatable, literally addictive food makes more money than food that isn't addictive. And teaching doctors more about nutrition isn't going to change that. My belief, not a fact that I can prove, is that doctors don't really need to learn more about nutrition. What I think we really lack, and what patients really need most of all to help improve their diet, is increased contact time to support and reinforce their behavior change. And for that, it turns out that we already have this awesome, entirely separate, invaluable healthcare professional to fill that role: dietitians. Patients really do need full, regular, dedicated sessions with condition-specific guidance and health education on relevant topics like reading food labels, macronutrients, and more. And doctors very rarely have the time and capacity to fill that role, especially when there is an entire field of specialists available who have dedicated their entire career to doing it better than us. So go and high-five a dietitian sometime. And if you're struggling with diet and exercise, please talk to a doctor. They can help, and if you feel like you could use some additional support, they can help refer you to someone who can provide it. Another one of the more common things I help manage in patients is high blood pressure, also known as hypertension. Most of the time when we talk about hypertension, we mean essential or primary hypertension, which pretty much just means that it isn't being directly caused by another medical condition. The exact causes of essential hypertension are hard to pin down in every case, but we know that most of the time it's related to a combination of genetic, environmental, and lifestyle factors. I think one of the most important things to address first when it comes to high blood pressure is why we actually care about it. Patients will often be surprised to find out they have high blood pressure, especially if they haven't seen a doctor for several years, because it's usually asymptomatic, meaning that it doesn't really feel any different or like anything is wrong with them. And sometimes this even leads to them questioning why it matters at all. But it's a silent killer. Think of it this way. Having uncontrolled high blood pressure is like having insanely high water pressure in your house. Eventually, it will start to wear down your plumbing, you might spring leaks, and everything else that's connected to the water will start to break down too. High pressure in your blood vessels over time can cause damage and inflammation, which in turn leads to scarring and stiffening of the vessels, which in turn can then cause blood pressure to get even higher again in a vicious cycle. This damage can also lead to atherosclerosis, or the building up of plaques in the arteries, limiting blood flow and increasing the risk of clots, strokes, and heart attacks. Dealing with high blood pressure can also damage all the organs that are connected to your blood vessels. The heart has to pump against higher pressures and can eventually begin to fail, stretching out and pumping less effectively. Small blood vessels in the kidneys can be damaged, leading to chronic kidney disease. Small vessels in the brain can infarct, meaning lose their blood supply, leading to cognitive deficits. And small vessels in the eyes can get damaged, leading to vision loss through a variety of different mechanisms. Thankfully, despite how bad it can be if left unmanaged, high blood pressure is rarely an emergency. Usually it will first be noticed with screening vitals taken at regular doctor's appointments. If blood pressure is noted to be high, usually someone will take it again in a few minutes to see if it goes back down. If it remains high, a primary care doctor is likely to recommend that you get a blood pressure monitor at home and take several measurements before a follow-up appointment to see if it remains high consistently. And they should coach you over how to properly do this before you leave. If it remains high, then it's likely that they'll discuss the pros and cons of starting a new medication at your next visit. Now, there are non-medication options that can help lower blood pressure, and they are worth mentioning here. Most notably, these include weight loss, the DASH diet, and exercise. Weight loss, for example, has a dose-response relationship to lowering blood pressure, meaning for every kilogram of weight lost, you could expect to lower pressure by about 1 point. For many patients, this means that losing about 5% or more of their body weight really could be enough to keep them off of a medication if their hypertension is mild. The DASH diet is a whole topic unto itself, but very briefly, it's mostly about eating healthy in general, with fruits, vegetables, and low-fat foods, and it's typically taught in conjunction with eating low-salt and no-salt added foods. For cases of mild hypertension, again, this really could potentially be enough on its own to bring someone back into a normal blood pressure range. Similarly, exercising 90 to 150 minutes per week at moderate to high intensity has also been shown to lower blood pressure enough for mild cases. Now, let me be clear. I'm super passionate about lifestyle change and all things preventive medicine, but I also love my patients, and I understand what it's like to live and to struggle and to feel like you're barely hanging on with everything life is throwing at you. I understand that if I were to just say to someone, hey, go lose 15 pounds, everything will be fine, that would be monumental, perhaps even an insurmountable task for some people at different points in their life. The same thing goes for telling them to radically change their diet, or to start adding nearly 3 hours of high-intensity exercise to their already busy schedule each week. Sometimes, medications really are the best way to help, especially when damage from uncontrolled high blood pressure is cumulative, meaning it builds up gradually over time. And the time to benefit for blood pressure medications is actually pretty good, about 9 months, with increasing benefits as treatment length continues. There is a huge amount of nuance and science behind that, but what I'm trying to get at here is that blood pressure medications don't take very long to start reducing the risk of serious events like heart attack and stroke. So it may even be reasonable to start one temporarily until someone reaches the point in their life where they've got things under better control and feel like they have the bandwidth to focus on diet and exercise to work on lowering their blood pressure naturally, with a potential goal to eventually be able to wean off medications in the future. I still have to add that, though sometimes, even when someone is doing everything right, they may still require medications. There are plenty of otherwise healthy people out there that, for whatever reason, still need 3 different medications to help keep their blood pressure under control. So take that with a grain of salt. Or don't. Take it with a salt-free substitute instead. I won't really bother delving into specific blood pressure medication choices, as there are a ton of different medications to choose from, and they all have their own pros and cons. So I'll just leave it at saying that that's a conversation best had with your own personal doctor. I know I've been going on for ages at this point, and there are still so many different heart disease related topics I haven't even begun to touch on. But I don't want to ramble too much more, so I'll leave with a couple of final thoughts on chest compressions and end-of-life care. And I'll keep it extremely brief and extremely specific, as full books can and have been written on this stuff. What I just want to say is that if you or a loved one are really, really sick, or really, really old, or really, really frail, there comes a time when one should think seriously about at what point it may no longer be worth having chest compressions done in an attempt to help preserve or prolong their life. Chest compressions do absolutely save lives, but they're also brutal. The whole point of chest compressions is to manually compress the heart from outside the body to keep blood and oxygen circulating inside. What that often means in practice is a rotating series of large, fully grown adults pushing down on somebody's chest with most of their body weight about once per second. And this can often go on for 20 minutes or more. It will and should break nearly all of someone's ribs in the process. And again, for most people, for most of their life, if there's even a low chance that it might bring them back, then it's probably worth it. But I've also seen 90-year-old patients in the hospital with serious infections who weigh maybe 80 pounds max that have full code on their charts, meaning they want you to do all possible life-saving measures. And sometimes that just doesn't make sense, especially when the benefit is extremely unlikely and the possibility of harm is certain. I've seen extremely sick ICU patients declared dead after 20 minutes of hopeless chest compressions, instead of being allowed a peaceful passing with comfort care, surrounded by their family, just because their loved ones felt like not doing compressions would be giving up on them. Just some food for thought. Okay guys, here's the final results. Let me know what you think. I am pretty satisfied with it myself, and I like the way the lines from the blood vessels connect with the background design as well. I think the directionality of the line helps contribute to a 3D effect on the heart when you look at it from certain angles or with motion. And if you wait to see when I move the camera in a circular motion, the background effect is pretty crazy visually, and I do think the illusion came out pretty strong overall. Hopefully the illusion and subject matter helps bring to mind the idea and evoke the experience of heart disease. And hopefully you learned something or gained a new insight and didn't mind my ramblings too much going on for so much longer this time around.